Hey, mamas and daddies! It's time to celebrate because you have successfully sailed through the first trimester. You may have heard that the second trimester is when the fun begins. This is when most people see that their morning sickness has vanished and their energy levels are back up. They are also very excited to finally feel their baby moving for the first time. So, what can you expect in your fourth month of pregnancy? Let's find out in today's episode only on our channel. At 4 months pregnant, your baby is now getting longer and heavier by the week. All of those tiny cells are rapidly dividing and turning into new tissues and organs. At the same time, your body is going through many changes. So let's get started. Number 1, hemorrhoids. Although hemorrhoids usually occur in the third trimester, they can appear in the 4th month as well. Why? Because as your baby grows inside your belly, the uterus puts pressure on the blood vessels near your anus. This increased pressure causes the veins in your anus to swell up. These swollen veins are what we call hemorrhoids. Hemorrhoids can be very uncomfortable. But don't worry, there are a few things you can do to ease the discomfort. First, make sure to eat plenty of fiber and drink lots of water. This will help keep your bowels regular and prevent constipation. Constipation can make hemorrhoids worse, so it's important to keep things moving. Next, try not to sit for long periods of time without moving around. If you have a job that requires you to sit for long stretches, get up every half an hour or so and walk around for a minute or two. You can also try standing up and doing some gentle stretches. These simple measures can go a long way in reducing hemorrhoid discomfort. Finally, don't be afraid to use over-the-counter creams or suppositories. There are a variety of products available that can help relieve hemorrhoid symptoms. Just be sure to talk to your healthcare provider first. Now you know how to take care of yourself. Number 2, sensitive gums or teeth. Pregnancy hormones can wreak havoc on your gums, causing them to become swollen and more prone to bleeding. This can make it seem like your gums are extra sensitive, but it's really just your body's way of reacting to the changes that are happening. To keep your gums healthy during pregnancy, be sure to brush gently and regularly. This will help remove plaque and tartar buildup, which can lead to gum disease. If you're not used to seeing your dentist regularly, now is the time to start. It's important to get professional cleanings and checkups as often as your healthcare provider recommends. And if you're expecting, don't worry about getting an X-ray. Most dentists have special X-ray machines that take images quickly and safely. Plus, many dental offices offer sedation dentistry, so you can relax during your appointment. Number 3, varicose veins. If you've got the type of job that requires you to be on your feet all day, then you might be at risk for developing varicose veins. But don't worry, there are a few things you can do to reduce your risk. First, make sure to wear comfortable shoes that support your arches. Avoid high heels and narrow toe boxes since they can make varicose veins worse. Instead, opt for flats or low heels and wear socks that provide good cushioning. Next, try to avoid standing in one place for too long. If you can, take breaks to sit down and elevate your feet. You can also try walking around or doing some light stretches to improve circulation. Remember, good blood flow is essential to preventing varicose veins, so keep moving and you'll be good to go. Don't forget to share this video with your friends and family. Number 4, pregnancy food cravings. Morning sickness might be gone, but another food-related issue may have taken its place: cravings. We understand how frustrating it can be when you're craving something specific and can't stop thinking about it until you get it. Our advice? Indulge occasionally. But don't obsess over these cravings or eat whatever comes to mind. Make sure you are eating a balanced diet with plenty of fruits, vegetables, whole grains, and lean protein. If you're craving something sweet, reach for a piece of fruit. If you're craving something salty, snack on some nuts or popcorn. But if your cravings are getting a little weird, don't hesitate to speak with your healthcare provider. Unusual cravings could be an indication of a nutrient deficiency. For example, if you're craving ice, you might not be getting enough iron. If you're craving chalk or dirt, you might need more calcium. A quick chat with your healthcare provider can help you figure out what you're missing and how to get more of it in your diet. Number 5, boost in energy. Yes, the famous pregnancy glow. You may notice that your skin looks clearer, your hair is shinier, and your overall appearance is just brighter. That's because your body is finally adjusting to the hormones of pregnancy and your internal rhythm is syncing up with your external environment. You may also find that you have more energy during this time. This is due to a combination of factors, including the fact that you're no longer nauseous and that your body is producing more oxygen. Your growing baby needs a lot of oxygen, so your body kicks into gear to produce more of it. This means that you'll have more energy to tackle your daily activities. And let's not forget the joy of being pregnant. Once you've gotten past the initial shock and excitement of finding out that you're expecting, you may start to feel a sense of peace and tranquility. This is because you're focused on the positive aspects of life and the future of your child. This shift in perspective can bring a sense of clarity and purpose that can make you feel more energized and motivated. Number 6, increased libido. When you're pregnant, your body goes through a roller coaster of hormonal changes that can affect your libido, and it's perfectly normal for your sex drive to increase during this time. During the 4th month of pregnancy, as your body adjusts to the growing baby and the increased blood flow, you may find yourself feeling hotter than ever. The surge of hormones like estrogen and progesterone can make you more sensitive and responsive to touch, which can lead to an increased desire for intimacy. However, if you're experiencing any discomfort or pain during intercourse, it's important to talk to your healthcare provider. It could be a sign of something else going on that needs attention. In general, it's always a good idea to listen to your body and do what feels right for you. If you're enjoying the ride, then go for it. But if you're not in the mood, that's totally okay too. The most important thing is that you and your baby stay happy and healthy. Now that you know what to expect from your body, let's talk about your baby. How big is your baby? At 4 months, your baby is about the size of an avocado. On average, babies measure about 4 to 5 inches long, about the same as a head of cauliflower or a large avocado. They typically weigh between 3 and 5 ounces, roughly the same as a bell pepper. But that's not all. Your baby is also getting longer and thicker, gaining about half an inch in length each month. Their brain is rapidly developing, with new neurons forming and connecting every day. And their senses are starting to sharpen as well. They can hear sounds from the outside world, including your voice, and they can even distinguish between different tastes. But that's not all. Your baby is also getting more active. Although you may not be able to feel it yet, their movements are becoming more pronounced, and you may start to feel 10 movements twice a day. We suggest that you keep a record of your baby's kicks and turns to make sure they're getting enough oxygen. It's important to note that every baby is different and develops at their own pace. Some babies may be born early, while others may be born late. Additionally, not all fetuses will be exactly the same size at a given gestational age. Factors such as genetics and overall health can play a role in determining a baby's size. It's important to remember that all babies are unique and develop differently. So, don't worry if your baby isn't exactly on track. As long as they're healthy and growing, that's all that matters. We hope you enjoyed learning about your changing body and growing baby at 4 months pregnant. Remember to take care of yourself, stay healthy, and enjoy the journey. Congratulations on entering the 2nd trimester.